Well, welcome. I'm Ruth Bowick, and I want to welcome all the viewers to what we call Healthcare for the 55 Plus. Today, my guest is June Dearborn, and she's part of the Sunset Family Health Team. Now, this informative program is going to be out in the airing view on Channel 10, thanks to Shaw Spotlight. And I'm so pleased that Shaw Spotlight has invited me to be the interviewer with all this regarding a number of professionals here at the Patterson Clinic, pertinent healthcare for seniors. Now, I will add that I am positive that everyone viewing this show is not only for seniors, but we are concentrating on that because that's what healthcare plus 55 is all about. So everybody watching is going to glean a lot of information on what Family Health Team has to offer. So now I'm going to get right into you, June, and I want to mention first off, and I did kind of mention it to someone before, but not in detail like I want to mention it now. Years ago, when I was reported for my Beeline at the mine, I used to go to a lot of seniors, especially in the like Gardner and Parkview and all those places, to interview them on their 80th birthdays, 90th birthdays, some 100 even. And they'd be sitting like this, and I'd be interviewing them, and right over there on a TV table, it was loaded, absolutely loaded with pill bottles. Mm-hmm. And I remember saying to many of them, like, "Do you really take all those pills?" Well, they weren't too sure, and then they were cute, men and women. Yeah. They'd go over and they'd pick up a bottle, and I take that in the afternoon and evening, and then they'd pick up another bottle. Well, I don't know. I haven't taken these pills for a long time. Mm-hmm. And then they say the other one, well, gee, this one's empty. So I'd like you to explain this thing. Like, are they nervous to throw stuff out, seniors, or is there something we can do to send somebody once in a while, once a year, maybe to visit all those people and kind of clean out that?
Well, we don't have a formal program to send people and do that, but it is a good idea to periodically go through your medication. Anything old, anything you're no longer taking, anything that gets stopped by a healthcare provider, you should take it back to your pharmacy for safe disposal.
Oh, right. I know, that's right. Not just flush it down the toilet. Right. Let's make sure that
all pharmacies have a environmentally approved waste management system. Good. Mm-hmm. So if you take it back to them, it'll get destroyed in the proper way. So it is a good idea to periodically go through your medications. And that is a common problem that I see.
You see it too.
Mm-hmm. People will bring their medications in, and they have a lot of very old medications that they're hanging on to for whatever reason. I think there's multiple reasons sometimes, but yes.
Do you think they hate to throw it away in case they need it again and then they want
Yes.
Yes. Uh-huh.
Yeah.
Uh-huh.
The problem with hanging on to things too long, there's several problems, but one is the medication itself can become expired, so it's no longer effective.
Oh, right.
There are a very few number of medications that can actually turn into something toxic as they age. That's not common, but there are a few medications like that, so they can be harmful as they get older. And sometimes starting something you used to take before with medications you're now taking may no longer be safe. It may have been safe 4 years ago when you had a different recipe of medications, but now with your current recipe, it may not be safe anymore. So you can incur some risk that way too.
Okay.
Yeah.
So that's really the.
It is important.
You think maybe that they don't see it like. They just don't want to throw them out. Maybe they don't want to get rid of them in case they might need them sometime.
I think that's part of it. Sometimes people have paid out of pocket for the medication, so there's a cost, and people don't want to waste. Sometimes the problem's gone away, but there's the fear it may come back.
Yeah, that's what I was thinking. Then they wouldn't have to buy it. They could use those old 4-year-old pills.
Those old ones, yes. There is a program through community pharmacies where patients can take all their old medications in and at minimum once a year have a review of medications. So anybody over the age of 65 on more than 3 medications is eligible to do that.
So they take them into the pharmacy, or they?
Yeah, they just ask to make an appointment to review the medications.
Okay.
It's called doing a meds check. You can also do that more frequently if other certain conditions apply. There's sort of a variety of conditions, but if you get out of hospital, if you've had, if you are living with diabetes, certain conditions, you can have those meds checks done more frequently.
Okay.
But for most people, they can get one done at least once a year. Even younger people, if they're on more than 3 medications, they can get a meds check done, and it's covered by the government.
Oh, it is?
Yeah.
So that you just put them in a plastic bag and take them all to your pharmacy?
Yeah,
Okay.
you do have
But
to
make an appointment.
prearrange with the pharmacy.
Yeah,
like,
because they're
what's a
so
good
busy
time
just
to come.
trying to get their drugs ready for other people that they don't have time to
Because every
go.
pharmacy does it different. Sometimes they do it on certain days, certain hours, that kind of
I
thing.
see. They could say you could come Tuesday at
Arrange
2
ahead.
o'clock or, yes,
Yeah,
okay.
it's always a good idea to arrange ahead.
Very good. Now, you did mention something about some of them are expensive, and I just heard on the news, I think it might have been yesterday, and I'm pretty sure it's the Ford government of Ontario, something about he's going to introduce a new pharmacare for across the board. Have you had any previous or new information on that? I mean, it's fairly new.
No,
because I thought,
haven't
I pay only
heard.
$4.11 for the blood pressure pills I take. So some I guess the government's covering that. But so I was kind of wondering, like, why does he have to have a new pharmacare when?
Well, I haven't heard that,
Okay.
but certainly lots of things are being looked at by the provincial government. So I think everything's fair game right now.
Oh, I see. Okay.
So I think they're probably exploring different things, but I haven't heard anything definitive. Yesterday in the federal budget, there was mention that they are going to look at developing a national pharmacare strategy, and that would take a long time to do, but it's the start of it. So they've designated some money to look at that. What they're looking at is perhaps being able to negotiate as a country better prices for drugs.
Oh, yeah.
So that may be of what
maybe,
you heard.
Okay.
Yeah.
Maybe it was that one. Okay.
Yeah. And that was in the budget yesterday. And that's the first time.
Well, I did hear this about
federal
Ontario,
government.
that Ford is going to do something, but I didn't.
It could be. I mean, we hear new things
Well,
all
I guess
the time.
there are a lot of people just on the 2 pensions, the Ontario pensions, and and it comes to maybe about $1,200 a month. Well, if they're paying rent and everything, it must be, especially some
pretty
medications
tight.
are expensive.
Some are, and not all medications are covered. But,
Okay.
Yes.
Yeah. Well, let me go on then. We've got kind of that pretty. Now, here's another thing that I heard too, that oftentimes seniors will lower their doses that was prescribed because they feel that, well, it's done enough for them, they're okay now, so they're going to lower the dose or sometimes maybe even stop taking it all. Now, I don't think that's a good thing. Would you like to explain that to our viewing audience here, why they should be very careful about lowering the dose?
Yeah, well, sometimes people lower or increase, like self-adjust doses, and I certainly hear about that. It's never a good idea, I don't think, to do it on your own. I think sometimes there is a case to lower doses or increase doses, but you should talk to your healthcare professional, your family doctor, whoever prescribed you that medication should probably be reviewing whether or not that's safe.
Before they go ahead and do it on their own.
Before they go ahead and do it on their own. I mean,
because that's important, that you follow everything, the directions
it
carefully.
Is. And if you are taking less of a medication and not, for instance, if a doctor prescribed you a blood pressure pill and you decided you thought your blood pressure was fine and you would lower the dose, if you went back to the family doctor and didn't tell him that you were taking a lower dose and he saw that your blood pressure was higher, he may decide to add on another medication that you really maybe just don't need. Maybe you just need to go back to the old dose. But if you don't say that you've done that...
Okay, because that could be dangerous.
It could be dangerous. Yes. And sometimes that's how pills grow, when they don't need to.
Ah, I see. Okay.
Yeah.
Well, that's really interesting because I know that happens a lot. Like they just...
Yes, people do
People have even said, I
doses.
feel really good, I'm not going to take this anymore. And then the bottle's sitting there. And then that's when they get 4 years old and they think they might need them.
Right.
Yeah. I mean, it's really not I shouldn't be, it's nothing to laugh about, really.
No,
but,
it can become
they
serious.
Do. Yes, absolutely.
Some people think they're going to lower their dose of their blood pressure pill, and they actually lower the dose of their thyroid pill. Like they actually have the pills mixed up in their own mind, what's for what. And so people may have good intentions, but do something harmful unintentionally.
Right. Yeah. And I noticed too nowadays a lot of pharmacists will package your pills in a little box and Monday to put
Yeah, those are called compliance containers. So it's just a way of helping to keep track of medications. The advantage to that system is you don't need all the bottles laying out, like you mentioned.
Okay.
They're all basically contained in the package. Sometimes there's still a few bottles on the side for as needed medications, like for instance, as needed Tylenol may be in a vial on the side. But all of your regularly administered medications are in a package.
Okay.
The advantage to that is sometimes, one day seems like the other day. And sometimes you can't remember, did I just take that at 8 o'clock this morning or did I not? And you can pull out the pack and look, they're still there. Or yes, I did take them. So it's a way of helping keep track as well.
Okay. Well, explain that to me then, because I don't have one and I hope I never do have. So it's a little box. So say there's you have to take 3 different kinds of pills on Monday. So is there 3 little separate things for Monday? One that'll say 8 a.m., one 12 noon, one before bedtime?
Yeah, there's
so that
usually
it is,
in those packs, there's 4 slots for each day. Breakfast, lunch, supper, bedtime. Now, not everybody will have pills in those slots, but they're capable of holding that.
You just don't put all the 4 pills in one little thing and hope that the person taking them will know. Okay, so there would be 4 things for Monday or whatever, 4 for Wednesday, or 3 or 3, whatever.
1 week at a time on a card. So Monday to Sunday.
Yeah, they're really made quite well. These little containers. What do you call these containers? Is there a name for them?
I call them blister packs.
Oh yeah, okay.
Yeah, there are and the pharmacist and the technician blister pack that for you. People can do a similar thing at home with cases. You can purchase what's called Dosette packs. So those are hard plastic cases. So some people who maybe don't have as many pills just take things every morning. They can put all their pills for Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday in a weekly case.
Okay.
And same thing. So then they just look at it and then they know they've had their pills for the day.
Okay, or it even might be good if there's a family member that's concerned about their mother or dad or their aunt or uncle, go in and do it for them. So now look, Mom, here it is all set for you. Yeah, okay.
Yeah. And we often see family helping with medication sometimes.
Well, that's good because medication is so important. I never realized how important it was till now. I'm on a couple of things for my eyes, for preservation, and then blood pressure pills. And then off the counter, I take some calcium and some zinc and stuff. But the prescription. So now I'm realizing how important it is to be very careful. And
you do have to be careful, even with over-the-counter medication. Even though you can purchase it without a prescription, some over-the-counter medication can be dangerous when mixed with certain medical conditions or medication. So you still have to use caution. Well, you wouldn't know that.
You would just use me for an example. I would go in and buy this one off the counter, and I should phone my doctor or my nurse practitioner and say,
or ask the pharmacist. The pharmacist is readily available.
Oh, okay. They don't mind telling you. Okay.
Yeah, but you should update your doctor or nurse practitioner at your next visit and say, I've decided to take this supplement for whichever reason.
Calcium, zinc,
and just so they're aware as well.
That you're
you're taking that. Yeah.
Because I never thought that something could be disastrous to your health by just grabbing a bottle of pills off the counter.
Yeah, there are drug interactions all the time.
So that's scary.
All the time.
That's very scary. I wouldn't like that. Yeah. Okay.
That's why we usually encourage people as well to go to the same pharmacy all the time so that they can see the list of prescribed meds you're taking and they could pull that up and check the bottle that you are interested in purchasing and see if there's a drug interaction there.
Okay.
If you have your medications at 3 different pharmacies,
that's not good.
Yes, we're not all linked. We can't all see.
Oh, they're not? Oh, I thought they were in Kenora.
No.
Oh, because I even thought that if I went to the States and ran out of my blood pressure pills, I could go to CVS down there and they could just go into the computer to Kenora. No, that doesn't happen.
That does not happen.
Oh, okay.
All right. We're not all linked in town.
Oh, okay. And you're not all linked in
Ontario. We're not all linked across Canada, even though it could be a chain store. You can call and get the information, always. But we're not linked by computer where we can view other stores.
So if I did run out, say I'm in New York with my daughter, and I could go into CVS and have them phone, I could give them the phone, and they would phone, and then
they would call the pharmacy.
That pharmacy would say, "Oh yeah, Mrs. Bowie does," and then they. CVS would probably give me a prescription, or maybe enough just for the few
Yeah,
days
I
I'm
can't
there.
speak. Every
No, I know, but just
every province, every state has different laws of what pharmacists can and cannot do in those situations. But they could always call and get a list of what you're taking.
because a couple of times they've lost my suitcase, and I've had, you know, and once it was a whole week.
Yes.
You know, and so I had to, not knowing what now you're telling me, I just did without for the week. But it bothered me.
Yes. Yeah.
You know?
And it can be dangerous in some conditions. You know, going without blood pressure medication.
So if it ever happened again,
could be dangerous.
that I would just go to the Bonnie or my daughter, take me to the drugstore. I'm going to have them phone and okay, that's good advice. That, although I don't have many people travel as much as I do, but over 55, but I guess they do. Yeah. Anyways, I'm going to go on now. Some seniors, when they do finish the required doses, they will not phone their pharmacist to ask for a refill. I don't know why they won't. Even though it's prescribed right on the bottle, there's 1 to 2 refills or 3 refills. Do they think that that's enough? They're not going to bother anymore? Like, why do they do that?
I can't explain all cases, but sometimes it's just a lack of understanding, or they didn't understand the plan clearly enough that, you know, we're going to prescribe this. It's a daily medication. When you follow up, we'll check and see if you still need it or not. Sometimes they just assume when the pills are done, I'm done.
Oh, maybe they don't even read that. Because there is a little thing on the bottle.
Not everybody reads all of the label, but generally it is a good idea when you start a new medication to be clear with the prescriber, your family doctor, nurse practitioner, you know, what is the plan? If it's a new blood pressure pill, you know, is the plan I'm going to take it for a month and then come back and we'll recheck the numbers? Or is the plan I'm going to take it for 3 months and come back? You know, just to know what the plan is, so you know what you're supposed to stay on versus what you're supposed to stop. Because sometimes that is the plan. Take the antibiotics for 1 week and then you're done.
Okay, and then, but it will say...
But not always.
Okay.
Yeah, so you just have to be clear what the plan is with the medication.
Another thing I found out in Kenora, like my pharmacist, and I'm sure it's all over, they're very good. When you're going to pick up your prescription, the pharmacists seem to be very good at explaining it in very good detail to you, so you know exactly where you stand, what you should do, and they have no hesitation in taking the time to do that. And I'm really grateful for that, because you know,
that is our training.
Oh, it is.
You know, we specialize in medication.
Okay.
So you know, we just have lots of training around that, and that's our job when we're dispensing medication, is to make sure people know what it's for, how to take it.
Because the last time I picked up something, there was so much pamphlets inside the thing. I can't be bothered reading all that stuff. Oh my goodness. Yeah. So I was so happy that the pharmacist would tell me, now Ruth, you know, this is okay.
And if you ever pick up anything and you don't have that opportunity to meet with the pharmacist, sometimes they're speaking with somebody else at that very minute. Sometimes, you know, they're just tied up in another task right at that very minute. You can either just wait or make an appointment to come back or call. Like, they're always available.
Well, I think most of us seniors can wait because we really don't have anything else to do. Like, we're not pressured, you know, going to go and somewhere.
Sometimes people are
and
there
especially
with
all of them all now, I
and
noticed that they all have chairs you can sit in.
Yes.
Which is really nice.
Do.
Yeah. Now I'm going to take a little bit of license here, because this has been a bane of contention with me. I'm not very strong, and I found these, but you know what I'm getting at, don't you?
Yep.
And I don't want that in the way here. Now this was a prescribed medication, and you know, to open this,
it's hard.
It's really, now I suppose it's
a
law. Is it the law for tampering, or for kids can't get at it, or little kids or something?
There's a law that you actually have to dispense all medication and child safety cap, but there is a so-called escape clause on that. You can sign a waiver that says, I'm okay not getting the child safety caps.
Oh, okay. I did not know that, because that's what I'm going to ask for from now on.
Yeah, so you can just request, can I have, I call them easy off or snap cap vials instead.
Because these are just, I just don't have the strength.
Yeah,
you know?
so you can just simply make a request with the pharmacist, and they will make sure.
Yeah, and I've heard so many people say, older people say, that they really, that's the most difficult thing and the most aggravating thing. So all of you out there in Shaw Cable 10 land watching this, you can now request, and what do you call it? A
snap cap.
A snap cap. Okay. So then I'm going to go on to this big bottle. It's the same thing.
Yes, unfortunately, from the manufacturer, you can't request that.
Yeah. But not only, but the thing that really really annoys me is, and they got all these instructions that
I know.
people. Anyways, by the time you get the cap off, and it's really difficult to put. Then there's a heavy thing here.
Yes, a foil.
And a little teeny tiny flap. So you got to get a knife and you puncture this thing.
Yeah.
I mean, it's ridiculous.
Yeah.
But I do respect the reason why.
Yes.
But so this you
it's
couldn't
a
do because tamper
thing.
So this you can't do anything about. You just got to persevere and put up with it and run to the door when you hear someone coming to the door to open your bottles for you. But I got to. What is the name of this again?
Snap caps.
Okay, I'm writing it down.
Yeah, or some people call them easy off caps.
Or easy off.
Yeah.
Okay. All right. Well, I'll have to get rid of these somewhere. So now I think I pretty well sort of discussed what I wanted to ask you, but I'm actually positive that you yourself have some things you would like to direct to the senior 55 plus audience about drugs and whatever. So would you go ahead and, when we've got some time left?
Well, I think you touched on a few of the things already. Medication safety is important, and usually there are a few simple things people can do to keep their medications as safe as possible. So one of them is keep an up-to-date list of which medications you're on. Carry that with you all the time. Keep it in your purse. Maybe give a family member a copy. Some people put a copy on their fridge. It's just always good to have a current list of your medications. So if you ever go see a specialist, if you ever, like yourself, you're traveling, if you ever end up in emergency for whatever reason, you have that list of medications. That way, the person you're seeing is not going to prescribe something that could interact with what you're already taking or be unsafe with your medical condition. The other thing is, if you have that list, it saves time. So at specialist appointments, you want the time to ask the questions you want to ask, get the answers you want to know about. You don't want half of the appointment taken up with trying to determine what pills you're on and at what strength and what dose. So, yeah. The other thing is, like we mentioned, clean up your medicines. Take old medicine back. Remove things that you no longer need from your home. It just keeps things safer so that you don't accidentally take something old that may not be safe anymore. And I do recommend people periodically review with their family physician or nurse practitioner their medications from time to time. Because your body does change as it gets older. Sometimes medications you needed when you were younger, you don't actually need anymore now that you're a bit older. Or doses need to change as your body changes with aging. So it's always a good idea to review your medications periodically.
Okay. Now let's go back to something you mentioned, that you should carry all the list in your purse, say if you're going out of your way on holiday or something. So supposing I pass out on the street, the ambulance picks me up, takes me to a hospital. So even here in Kenora, okay? Have the people, the attendants, the doctor, the nurses, and can they go through my purse? I hope so. I
can't really.
Like, how can they find out? Yeah, but how can I find?
Normally,
if they're in my purse and they can't get at them.
Yeah, I don't know how they work around that, but I know sometimes if people have presented to hospital or to clinic here and we don't have their list of medications, we track down what their pharmacy is, call there.
But you could phone 5 pharmacies in Kenora.
Yeah, sometimes we have to. Yeah. So that's why if you travel with a list, it's best.
Yeah, but then of course there's the thing again though, that they can't go in your purse and go through.
I don't know. I can't speak for them.
And you're right out of it. You can't say yes, it's okay.
Yeah,
like you're banged on the head or something, and you're
They can track through your health card. There is a drug database that they can go into and track medications that have been filled for you. That doesn't necessarily mean you're still on them, but they can see what's been filled for you under your health card number.
Okay. Yeah. So that's good to know, because unless you have a locket or something, you can put a list in your locket.
Yeah. The other thing people can do is, if they do have serious allergies to medication, which is a problem for some people, get a medical alert.
I never thought of that. Yes.
Because, like you say, the medical alert will speak to you.
That's that bracelet or thing you wear around the neck if you fall and you can't get up, that one?
No,
or is there another one?
There's another one. So if you're, seriously allergic to penicillin or things of that nature, you can wear what's called a medical alert, which has those serious allergies engraved in it, so that when you do
Uh-huh.
you ended up in emergency, the actual medical alert will be able to alert them,
okay.
you know, don't give this person this medication
Okay.
that they have a serious allergy to.
See, that's another thing I because I thought that the necklace or that one bracelet where if you fall, everything's somehow in there. With someday, soon it will be the way computers are going. There'll be a little disc somewhere that'll tell you.
Things are becoming more and more.
Yes.
There's
Technical,
more technology and things all
like
the
that,
time. Yeah, and even with medications. Yeah.
Yeah. So where did you? Are you a Kenora girl?
No, I
okay.
grew up in Manitoba, northern Manitoba. I went to school at University of Manitoba.
Oh, that's where you got your pharmacy. Okay.
Yeah.
Yeah. So you don't in a drugstore. You're strictly here to help people like with me with the
I did work in a drugstore for almost 20 years in a retail pharmacy setting. I loved it, and then I was looking for a change, so I took a job at the hospital.
Here in Kenora?
Here in Kenora,
okay.
yeah. And then...
so you did the pharmaceutical work in the hospital?
Yeah.
And then this came open or something over here?
This came open, yeah. I thought it sounded like a good opportunity, so I took it. For a while I was half-time at the hospital, half-time here, but now I'm full-time here. Yeah.
Okay.
So it's a little different, but it's interesting.
Well, I want to thank you very much because you've just been a wealth of information, and you're such a pleasure to talk to. You know exactly what I wanted to know, and if I wanted to know it, I'm sure there's several thousand people in Kenora that are over the age of 55 that are going to glean a lot of information thanks to Shaw letting us do this. So thank you again.
Thanks for having me.
And I shall return.